BHPN Presents.
Hey,
Hi,
AI Unplugged. Welcome back to another episode of Hey, Hi, AI Unplugged. Today we have with us our co-host, the one you'll know and love, Dr. Nikolai White, co-founder and managing director of BHPN. And today our featured guest, Dr. Noah Crampton, is the co-founder and CEO of Mutuo Health.
My name is Dr. Nick White. I'm a family doctor here in Ontario. My story is I attended undergraduate school or undergraduate degree at the University of Western Ontario in London, Ontario. Following that, I went to medical school at Howard University College of Medicine. That's in Washington, D.C. And then I completed my residency program at the University of Toronto, and specifically at Sunnybrook Hospital. And actually, Noah and I met in residency. We both attended the same program. So we're going to talk a little bit about that in a second. But following my residency training, I worked as a rural physician in a northern community where I was responsible for doing emergency medicine, hospital medicine, trauma, a lot of mental health, a lot of addictions, a lot of obesity and diabetes management. And that inspired me to do more education in obesity medicine. And that's an area that I specialize in. So I'm a diplomat of the American Board of Obesity Medicine. I do a little bit of research in obesity, but I also am a fellow of the Canadian Association of Aesthetic Medicine. So I do aesthetic medicine as my primary practice now. It's a focused practice. I don't work as a family doctor, but I do some locum work in a few northern communities up near Thunder Bay, as well as up in Moosonee, Ontario. And then, of course, I'm involved with the BHPN. This is an organization I co-founded in 2020. And we help doctors with entrepreneurship, finance, mentorship, career advancement. We've created a directory, which we are very proud of, that has over, I think, 250 listings. And then, of course, our organization now has about 500 members.
I'm a family doctor at Toronto Western Hospital, but my journey is kind of atypical. I've always kind of been more of like a futurist-oriented person. And so even when we were in residency, I was already thinking about, okay, in the consumer world, but even back then in 2014, we were seeing like Google search was doing some pretty miraculous things, and it wasn't really being represented in healthcare at all. But it was just a matter of time that was going to. So I was thinking, if that can already be done in the consumer world, like just what's the possibilities in healthcare and how that's going to change our careers? We're just like young doctors at that time, right? So I basically committed to continuing education. Like I did medical school at McGill University in Montreal. Then I did University of Toronto Family Medicine at Sunnybrook. But a lot of people after residency, they want to stop and go practice. And I was like, I think I want to get myself ready for the AI world that we're about to get into. Wow. So that's when I applied for this program called the Clinician Scholar Fellowship, where basically they'll pay you to work as a doctor, but you'll have a bunch of time for research. So 80% of my time was protected for research, and that's when I did like my master's in health informatics, focused on AI applied to primary care. And so that's how I got connected with sort of thought leaders in this space in downtown Toronto at Unity Health, St. Michael's Hospital, namely Mohammed Mamdani, one of the forward-thinking AI thought leaders here in Canada. And I did my research project about proving the concept of using the existing AI tools back in 2017, which is pre-ChatGPT, that we could, start tackling the problem of AI burden, the burden of clinical documentation using AI. And so we partnered with the Vector Institute, which is one of Canada's forward-thinking AI institutes. And my co-founder of my company, she was doing the research project when we did the research project, and it proved quite impressive that just even with those old technologies. So that's when we spun it off into a company called Mutuo Health. That was in 2018. And we built it up, like we'd had a whole application around it. We had privacy and security for healthcare all done. So by the time ChatGPT hit, which obviously like came at us like a meteor, like blowing up the whole world basically, we were ready with an application. We just had to switch the AI out.
You say switch the AI out. are you saying that you had an AI that was working, but you're saying the ChatGPT model was superior, or yours was immediately obsolete?
Yeah, and
but
so was everybody else.
so was everyone else's.
Yeah.
But you just had to flip a switch and boom, plug in the ChatGPT 4 model, and now you're running on the most
Yeah.
advanced AI
Yeah,
platform.
with a fully compliant for healthcare application, you know, so we were ready to like ride the wave of the market growth.
Yeah.
Because we were solving a very clear pain point, you know, which is you know doctors' notes and stuff, and we'll get into that. But really, what you know, it's been an exciting journey riding that wave. You know, like it's a huge new market, lots of players, obviously. But I'll talk a little bit later about what our you know unique strengths are at our company. But basically what's happened is we've grown very significantly across the country. Over 1,500 doctors across Canada use us daily. And so we were recently acquired as a company by the Well Health company. Their AI arm is called HealWell. And so, yeah, now we're like inside one of Canada's largest digital health companies, like building out the future innovations powered by AI.
That's amazing.
Nice. How exactly? So you both are co-founders. So you're a co-founder and a managing director of BHPN, and you're a co-founder and CEO of Mutuo Health, right? So let's talk about how you balance the demands of patient care with the responsibilities of being in these positions.
So going back to our training in medicine, you know, it's a very rigorous program, and it's not just about your patient care. It's about all of the other aspects that go into that, which include documentation, follow-up, responsibility. There's, you know, there's regulatory body compliance. There's liability risks that you have as a doctor. But patient care is why I got into this thing in the first place. And that means that I'm never going to stop seeing patients, but I need to balance it, right?
Right.
And the problem is, you know, in our training, we were trained in a way that was in a model where you had what's called a family health team. And in that model, you essentially have it set up that you can spend like 30 minutes with the patient, an hour if you really need to. You're not being paid in a fee-for-service model, so you don't need to turn through patients. You can spend the time. And so in our training, we were really good at, you know, a 30-minute encounter, which includes, you know, spending a good 15 minutes finishing your documentation, ordering all your tests, and then you're able to see the next patient. So you can see maybe 15 a day, 12 a day. Now, the problem is, you know, in that scope, essentially you're kind of stuck. You can't really, you're at capacity very quickly.
20% of practices across the province represent
this. I mean, when I went into the community, I had to see 50 to 60 a day to make enough money to support what I needed. And so it wasn't real. Like the concept of a family health team is not really what you see in the community in Ontario, right? Now, that being said, again, focusing on the question, which is how do I balance it? I'm now restricting my time, right? I have my patient care days. I choose those days, and that's it. I also am doing locum work, which means that I will go for a week to a community or 2 weeks to a community and work there full time. And then I come back home, and then I'm, you know, working on my businesses. Well, I'm not, like right now today, I'm not seeing patients, but I am working, doing things for the business. The work never stops as an entrepreneur. I mean, it's 24/7. You can ask my fiance. I'm driving around, making business deals, buying, you know, contracts, all sorts of stuff every day. But I have my patient protected time. And now with the technologies, when I finish that day, there's no more work to do. There's no more documentation, administrative burden. I can actually see 2 to 3 times the number of patients now with technologies like Dr. Crampton. So
I'm sort of like a bit of a unique case in that as I made my decision making early in my training to like go the, you know, I'm an AI entrepreneur and doctor route. And that's like, as a result, I was kind of deemed sort of a good hire for like a large institution. Like I'm at UHN now, right? So, which is one of the largest hospitals in Canada. And so because of my unique skill set, they actually carved out time. And so I still work at a family health team. And I work as a researcher there, so I'm able to use that researcher time to focus on, you know, the AI research that I'm doing anyways. Whether it goes at like the academic, you know, publishing route, or I'm spinning it off to the
Commercialization.
commercialization, I'm still doing the research anyways.
That's beautiful.
You know?
Right.
So, and
2 for 1.
Yeah, it's a good setup.
And they know this. They want you to do this.
Exactly. Yeah. So they've like, and I was one of the earliest.
That's not common,
people.
by the way.
It's not common.
Because usually the institutions will try to
Suck up everything.
and make sure they have control over the patents, the commercialization. They want to make sure that they're getting the monetization coming all the time. I mean, you might get paid like a salary, but they're not going to let you own the company.
Yeah. So if I'm using any internal data to UHN, they own it.
Yeah, of course.
And I'm okay with that.
Yeah.
But so long as they give me time and space to also work on my company, which they
Right.
have, and I've come to an
Exactly.
agreement.
And
'Cause
you're
I'm
adding
coming from
value as a doctor.
That's right.
So-
I'm seeing patients 4 half days a week now, so that's 2 full days.
So how many patients do you have in your practice?
My roster is 450.
So that's like that's considered like a maybe 3/4 to a halftime. We'll call it a halftime
halftime.
equivalent of a family doctor.
Okay. Yeah.
Most family doctors in the province would have a roster, I would say minimum 800, and I would say maximum 1,500 to 2,000. I do know people who have more than that, but that's not going to be.
That's not safe care.
It's not safe care.
Yeah.
So Dr. Crampton, is in fact a community-based family doctor.
And it's a lot.
And it's a lot of
It's a
work.
lot of
And it's
work.
not just seeing patients. Those 4 half days.
But I have the same motivation as you, right? Which is like I went into for patient care. It's still the thing
And you
that
still get
propels
to
me.
do it. You're
Yeah.
using your technology every
Exactly.
day.
Yeah.
You're seeing what's working and what's not working.
Yeah.
You're seeing the barriers, the gaps.
And I like the brain switch, like you use a very different brain when you're with patient care versus all the AI development and commercialization.
So just to hold on to that topic there, I want to touch on a point you made, Dr. White. You mentioned that if family doctors go over a number of patients that they might have on their roster or get seen a month, that's not safe patient care. And I also want to add, that's also not safe mental care for the physician himself. And it brings us to burnout. And I feel like I want to kind of give this question to you, Dr. Crampton, with Autoscribe. And just with your position as a family doctor working in a large hospital, you see those gaps. So how exactly would you say Autoscribe is filling that gap and how it improves efficiency in the healthcare sector?
Again, I keep going back to when you're in residency because it's like, I'm a futurist. And I was like, it's immediately when I experience something for the first time, I'm like analyzing why is it the way it is? And immediately in residency, we were spending all that time writing notes. I was like, why are we doing this, documentation after hours? I'm going to get burnt out so early in my career. And that's it's such a unfortunate, I've been trained so much, I want to give all my energy for a long career to patients. Right. So that's why I was like, okay, this is the pain point that I want to solve, which is all these notes that we have to write that are very slow to, put together. Because when you're with a patient, you're splitting your attention between asking them all the questions and not forgetting what the responses you're getting. You're quickly jotting down notes, but it's not in a standard formalized way. So you have to fix them up at the end of the day or, on the weekend. So with the data that we were able to get in that initial research project, which is recordings of doctor-patient conversations linked to the notes that they write themselves, we were able to train the model, the AI model, for the AI to predict the notes straight from the audio itself, right? And what we saw is that the amount of time to edit that note that the AI, because it's not going to be perfect. Right. AI is never exactly a replica of your own brain. But the amount of time to edit that note is so much less than writing that note from scratch, right? And after GPT came out, just the accuracy of the AI just got way, way better. So that editing time came way down, such that it really started to, per encounter, the amount of time savings on, I didn't have to wait to the end of the day to clean up my notes. I can clean up my notes between patients because it's only a few edits I have to make, right? Legally, as clinicians, we are mandated by our professional bodies to write accurate, comprehensive records of what took place in the clinical encounter, right? So that, so we can remember from visit to visit with that patient what happened, and we can share those records to other colleagues in the healthcare system. But B, in the worst case scenario, if, God forbid, we were taking, as a complaint to our professional body or we were sued or something, we would have all the key records to prove what happened. So totally fine, makes sense. Part of our work obligations, what we signed up for. But the amount of complexity of patient care that is, like, we started off with that, but what we heard from our seniors is that patients have become more and more complex over the years, and they continue to get more complex, so that the documentation becomes more complex, but we don't have more time to write all these notes. We have to take on more patients. The government's like, wanting us to take more patients, but they're more complex patients. They take longer time. But I saw what AI could do with language, even before GPT. Like, I could see that that's what's happening in the consumer world. So I knew that we had the solution, maybe not exactly there, but it was like just over the horizon,
Yes,
right?
Dr. Bailey did mention that too.
Yeah. And so when that happens, you gotta just like, okay, well, if no one else is trying to make this innovation happen, I'm just gonna take the initiative and do it. Like, that's sort of my sort of personality. And so yeah, now we have proof points, case studies that we're saving doctors thousands of hours per year, thousands of dollars, because they're just able to see more patients if they want,
And their experience of their work
is more joyful.
So, as we have explored the journey of developing innovative solutions in healthcare, like Autoscribe, let's shift our focus to a broader landscape of AI in healthcare, specifically in Canada.
Personally, I have tried since October to see if I could implement or see what kind of adoption levels we have here in Ontario, and I can tell you it's very low. Most physicians either have not tried the AI scribe. The reasons they don't try it mainly revolve around concerns with liability risks, patient confidentiality, consent, all of those things. And so I think physicians need to be educated a little bit on how to use this safely in their practice, how to introduce it to patients. There is a process. So when I'm using the AI scribe, I explain to the patient that I'm using software that will be recording our conversation, helping me transcribe my notes, and those notes will be stored in the medical record. None of this information will get anywhere else except for into their medical record. That's the promise I make. And as a physician, it's simply abiding by the patient privacy rules, right? So physicians need to recognize that, of course, like anything we do in medicine, there's risks. There's a process of providing informed consent to patients, right? The risks are also, you have to manage your patient data just like anywhere else. It's going to end up on your phone or your computer, so you have to have a strategy to mitigate that. Personally, I have an iPhone that I only use for the scribe and for my medical documentation purposes, and I found that flow works very well. It goes right into my charts, and so it's a nice system. That's my personal feedback.
I know what my client is and what they need. You just perfectly described what I have to sell to, right? And so I have to come prepared with all those answers, what we've done, privacy, security, a consent workflow, like all that stuff, so that a hesitant clinician can feel confident to try it, right? And if it works, they can start to do the implementation, the change management in their practice, and adopt it in a sustainable way. Right?
Let's talk at the physician level. So as a physician, if I can, sure, I'm going to end up seeing more patients, but there's eventually going to be a point, if you think about it, in theory, there's theoretically, there's a point where you see every patient in Ontario. Every patient. Right now, if we had enough doctors and we saw every patient for 2 years straight, unlimited, eventually we wouldn't need to see everyone all the time, right? There's acute care and stuff like that, but chronic disease management we have a template that should work, and it involves visits, it involves interactions, it involves all of those things. And so if we can improve efficiencies, reduce documentation time, which reduces physician time it increases my time by up to 50%, with the use of the right multiple AI techniques, right? So language learning models, processing models, integrative models, diagnostic models, all those things together can do the work of 10 doctors in one. You can do one doctor, do 10. So what you can do is you take one doctor and you make that doctor see 10 times the number of patients. I know it sounds crazy, but it's through the help of a team, nurses. Like a lot of the doctor stuff can be delegated, and in the U.S. it's all nurse practitioners. It's all GPs. So we don't have enough GPs. We know that, but we can do nurse practitioners, nurses, family health teams, community teams. We can use non-physicians to help do a lot of the work. If it's counseling, you don't need a doctor to sit there and counsel someone for 10 minutes. You can actually use an AI to educate them, right? So doctors need to review results, make diagnostic decision-making. They're coordinators, care planners, they're educators, they are experts. They do all those things, but there's a lot that we do right now as doctors that we shouldn't be doing. Doctors should not be doing the following stuff. They shouldn't be, writing emails to anyone. We shouldn't be writing notes. We shouldn't be reading junk mail, forms. We shouldn't be doing, we shouldn't have to move. Like we should just be able to sit there and like see patients unabated without having to move, type, just in front of a screen.
Yeah, and like, the value of the human. So, I mean, it's going to be human AI, like, dyads, right? Like, together. Their AI augments the human in their work. It doesn't replace the human. But, in terms of at the point of care, you want to get, like, there's no way we can review all the research in the world all at once, right? That's not human, right? But there's constant research coming out about what the next best evidence-based step is. So, of course, I would love to rely on an AI that can surface that for me. Like, that would make my patient care for that patient better. And so there's improving the quality of care in sick care, which is what we're talking about, right? Sick care, which is like a patient is already sick. We as a doctor have to manage that sickness and keep them from, like, get them better, cure them, or manage the chronic disease that comes from that. Perfect. That's my skill set. I can do that. What we also need is prevention, right? We need to keep patients healthy, and that's before they get sick. And that's where the huge opportunity for cost reduction is, because right now we don't have any interventions that are really holistically addressing that. I mean, there's little private opportunities here. You can go like Noom or Weight Watchers. I don't know. I'm just giving like examples that exist for behavioral. But where this is really going, and we touched on this earlier, is if you can prescribe an intervention to keep someone healthy, then they never go to the hospital. You save all that downstream costs, right? And so the amount of volume that they end up going to the hospital for, like the amount of patients that end up going to emerge, for instance, the population will increase, but they'll stay, like the total volume going to emerge will stay the same.
You were in the field gathering data and seeing the trends. So what would you say are the needs of Canadian providers and how Autoscribe is addressing those needs?
Yeah, so I mean, there's this burnout crisis. I think we talked about that already. And, I know it's only a few % of adoption in the market right now, but what we're seeing is significant growth. Like it's going to just continue because as people do word of mouth, the benefits are so obvious when people start using it, like your experience. But then it becomes more like, tying data together, right? Mm-hmm. This is where we're going in terms of the future of healthcare is the end-to-end patient record. They go to a primary care, they go to a hospital, they get a discharge in a rehab facility. Right now, all the data is like super hard to link up together, but they are.
It's all siloed.
It's all siloed, but they're moving towards linkage.
So towards a universal linkage.
That's right. So plan for that state. What can you do? You need high quality data so the AI can predict and, nudge the patient to do the right thing between visits of doctors, right? Not just at the doctor appointment.
Maybe every day.
Every day.
Reminders, take your medicine.
This is a personalized recommendation for you.
Did you walk today?
Exactly.
Did you exercise today? Yeah. I mean, it could be a whole, what you're talking about sounds like a concept of like a patient-centered, patient-controlled, autonomous system that they can use the AI as their own agent. Like agentic AI is really the future.
And it's not that far.
It's not that far.
It's really not that far. It's like an exciting place to be in the design stage of that.
Quickly tell us how Autoscribe is moving forward. What's the next steps for Autoscribe in artificial intelligence and how you're expected to transform the area of healthcare?
We're trying to provide value to physicians and high quality data to the system. Like that's our two driving forces right now, right? And so at the physicians level, clinicians in general, not just physicians, we're trying to automate as many of the administrative tasks that we can using AI. And that's so, as I mentioned earlier, we were recently acquired by the Well Health Group. And so we're deeply embedded into their EMR tech stack. So all those general tooling that doctors normally do, like they click a bunch of times to order a prescription or click a bunch of times to order a test or whatever, we're automating all that from the voice, right?
You're telling me I could say amoxicillin
And the thing,
for a week,
the prescription module will fill it
and
up
it can't
for you.
make an error.
Yeah.
It's not going to be a perfect script,
Yeah.
perfect everything. It double checks for allergies.
Yeah. It's the EMR of the future, right? It's through
So
voice.
with your position in Well, you have all the tools to just integrate right into their systems, and we should have a fully integrative platform.
Yeah. So that by the time you're done with the patient doing your evaluation, you sit that back down at the computer. It's surfaced. I heard you wanted to do all this. It's like prepare the prescription. It's prepare the test orders for you.
Nice.
It's prepare the referrals for you. You know.
Driver's record, license exam.
Yeah.
Requisition
Done.
Billing
forms.
code.
I just have to
forms.
sign forms.
Yeah.
You have to review.
I have to review and
You're
check
the
boxes.
reviewer.
Yeah.
That's how important review is becoming because it can make errors still, right? So you have to review and edit accordingly, right?
And this brings us to our next point that I want both of you to quickly address as well. It's AI cannot replace humans. It's there to support us, and you did mention that earlier. So just briefly tell us, go a bit more in depth, but not too much, and just how exactly address these concerns, basically, that we have about artificial intelligence on the outside of it replacing our jobs. Like, are we going to be able to still have our jobs in a few years? We still need to make money, or it's just there to support us?
Patients are humans, and there's that therapeutic relationship of human to human connection. We're able to use our medical knowledge as doctors to apply the best evidence to that patient. And now we're going to have just an amazing tool alongside of us as we do that process.
It
right?
makes it easier. It takes off some of the other factors. It takes off the relief. So what I am working on is a tool that can verify some of the diagnoses we make in medicine. So for example, you make a decision, okay, this patient is having a heart attack. And now I think the plan is to do this, this, and this. And you go ahead and do that. But while you're doing that, the AI is going to say to you, you're correct. Not like, oh, we think, no, this is correct. And as long as it's correct to me in an emergency, I know it's correct. But there's times where you're like, there's a 5% chance that instead of being 1 milligram of epinephrine, it's actually 0.1. If the AI can tell me, you're right, doctor, keep going, good job. At 3 o'clock in the morning when I'm in Manitouwadge in an emergency department by myself on the phone with an ICU doctor, that's value to me. That makes my job better. That makes me feel confident that my patients are getting the best standard of care. It may not be that they're they may be located in a tiny rural community, but it doesn't matter. They know the doctor they're seeing has access to the entire history of all of medicine, and therefore you were pretty good, right?
Yeah, I mean, and just to like put a fine point on it is, this is the area called clinical decision support, right? And the way regulators have thought of this is software as a medical device previously, so it like automatically enacts decisions for the clinician. But they're wrangling with AI doing this because to your point, like, why do we have to have a doctor make these decisions independent of these tools? The tools should be mandated. Like, if you're not using the tools, you're actually not going to be part of the standard of care very shortly. And so think of that world, because there's going to be a lot of doctors who are going to be resistant to this, right? They're going to, how do we make sure the large language model is not having hallucination, right? Like, these are really complex questions that we're going to have to wrangle with very quickly. So that's why we're tackling administrative issues, because it's so much easier, of a low-hanging fruit to get buy-in. But once you get into the decision support field, it's a whole other ballgame in terms of how, like, patients, providers, all the key healthcare stakeholders will, make sure that we're getting the benefits of AI without introducing new harms.
Amazing.
That's amazing. So you'd say it's important to maintain human oversight because essentially you want to ensure that these tools are being used ethically.
They have to be.
All right. And then finally, how can healthcare institutions better prepare for what's to come? We said it. AI is inevitable. We cannot hide from it. We cannot run from it. And how can we use, what role will training and education play in that regard?
I am constantly in conversations with healthcare stakeholders at the various levels in this province, but mainly the provincial level. And of course, they recognize that this is something we need to do now. And there's been efforts made from the federal government. A lot, we're in a situation where we're having elections and turnover and changes. And unfortunately, none of these projects that in fact I put in applications for at the federal level are going to be approved anytime soon. I need those funds so I can go out and do this because this is not a slow market. Tomorrow I'm going to wake up and realize that there's a new AI tool that now I need to change the plan for. So what I need to do is go now, right? I can't have these barriers to stop me because in 12 months, the conversation is not going to be about, hey, should we do AI? It's going to be about, we have this Chinese company came in and they monopolized our entire market and we didn't realize it. No, we can't do that. Dr. Crampton has created something that's Canadian made. He understands our system. Our system is not the same as the system in the UK or in the US. We have a very conservative system in the sense that we don't take risks in Canada when it comes to our health or in Ontario. Okay, so we need regulatory policy and oversight and guidance and patient privacy protection, all those things he's invested in that they've talked about. Those are the things we actually need. We can't just let these AI things run rampant. They're going to, you're going to see it happen in other industries and you're going to be like, wow, they just messed up the whole industry. Watch what's going to happen to social media. It's going to be all AI bot-driven content. Garbage. The whole internet is going to become AI and just garbage. That can't happen to our healthcare system. It's going to happen to other healthcare systems. Watch. Luckily, Dr. Crampton,
I'm bringing my physician values first.
Myself,
right.
BHPN, we're all going to be stakeholders. We're all working together. I don't care what anyone says. We are collaborators.
Which is important.
That's the Canadian way.
That's the Canadian way. And that's the difference between us and Trump.
Yeah, exactly.
Trump does not want to collaborate with anything. He wants to own it. He's going to own it. And it's
the smartest man in the room.
Right.
This ownership of this information is going to be owned by people of Ontario, one way or the other at some stage. Okay. But right now, you need people like myself and Dr. Crampton to help guide our
the expertise, right? And
exactly.
I have I'm not, tooting my own horn. I do have the expertise of medical and the information technology combined.
And it might seem small, but this is a tool.
I'm coming from a point of being a white male privileged space, so I have to represent my experience. And you guys have totally different experiences, and everybody else has a totally different experience, right? So everybody has to come to the table with their life experience and say that our linkage together, our collaboration together is better as a sum of the parts, right? It's not zero sum. If we agree that we're in this together as humanity, let's say, then we're gonna train the best AI. That's just how it works. It needs high quality data representative from all the participants in the system, which is everybody, right? So long as you communicate that, I'm very excited and passionate about representing my physician values where, we treat everybody that enters that door, no matter their life experience. The patients you described earlier with the mental health struggles and this drug abuse, we treat them no matter what. That's just how we operate as clinicians, right? And so that's how we have to think about representing a collective data set for our region. And let's say Ontario is our region, or Quebec is another region, a health system region. And so within that, each community has their own way of, that life experience manifesting, right? And we got to meet them where they are. So you guys invited me to this podcast. One step of me, trying to do that from my vendor perspective, but I'm doing that all the time. We work with the Indigenous people of Canada all the time. We work with people from different immigrant communities, right? So I personally am trying to establish these connections, but it's not just me. It's all stakeholders have to put that trustworthy first step forward, and I don't think we can't go back to how there was this like top-down paternalistic way the healthcare system was previously built. That's not how the dialogue amongst all these communities have to go. It has to be like, let's just horizontally meet. Everyone expresses what their concerns are. How can we, as a collaborative, address those concerns? Or else we're just going to restart the resentments of the past, right? That's what we have to avoid in this new AI future.
Yeah, I agree. And, what Dr. Crampton is saying is, he wants data and he wants real data. He doesn't want discriminatory data.
Yeah.
It's not useful for him. It's not useful for the AI. It's not useful for his company. It's not useful for our patients.
Right.
And beyond that, I know Dr. Crampton personally has always been someone like myself who advocates for patients that need advocacy. It's not even. Like, we see patients who know how to advocate for themselves, have the resources, and then we see patients who cannot advocate for themselves. And we write that down. We help them. We get them, money from the government in terms of like, these are patients who qualify for these things.
We do what we can. Right?
We do what we can. They don't know how to fill out the forms. Like, okay, no problem. Like stuff like that, right? That's where we can be helpful, and that's where we're equitable in the sense that I'm not gonna there's a patient who's a lawyer who came to me who wants to get their driver's license form completed. Like, go do it. I don't need to help you. But there's a patient who, lives in poverty, needs to figure out how to, get their job, and needs a letter to explain that they've been off for 6 months because of an illness. Like, of course I'm gonna take the time, and that patient needs my help more, right?
100%.
But that's where the human element comes. But with the AI, you gotta get that data. Like, you need to find all the patients. Like, in a
the
perfect
AI only knows what the data was trained on, right?
Right.
So
Yeah.
if you want it to be supportive for these types of patients you're describing, it needs to have seen that data before. But we need to get these communities consenting to share that data, right?
Yeah, so the communities need to understand this data is going to help them. It's going to create, what you're going to see is you're going to create the goal is an individual healthcare system. Like, I am me, this is what I need, these are the resources I have, my providers that are culturally competent to me and my culture.
100%.
Right? As a Black Canadian, I have a culture. I don't want to go to someone who's going to judge me. And it happened the other day. A doctor looked at me, and it's just not what you want. You want someone who understands what you're going through, or speaks your language, comes from the same culture, or maybe you don't, but it doesn't matter. And sometimes that's not a race thing. Like, sometimes it's like, I want a young doctor who understands what I'm going through because I have a company and I have, all these different pressures, and I relate to
That's a
that.
patient preference thing. The AI should be able to adjust that.
Exactly.
100%.
Yeah.
Yeah. Back to the point of collaboration. It is essential in patient care. Because like you just brought up, it's not just a race thing, or it's not just a Black thing. In different communities, there are different needs, which you had mentioned before. So you're positioned as a white male with privilege, but then you're serving the different communities, Indigenous, Black, Asian, and our needs are very different. Like you said, you walk into a room sometimes, especially as a Black woman, I go with a certain concern, it's not taken seriously. Whereas my counterpart, it might be taken more seriously. And things don't show up the same way for me as it would show up for you. So something as simple as a rash, it might get misdiagnosed because it looks different on a Black body, right?
100%.
So, and I think especially the Black community and being skeptical about artificial intelligence, the importance of collaboration in this sense, where a team looks like this, where it's not like, yes, this is the Black community, and the Black community would prefer to see Black physicians coming forward and speaking about, encouraging them to do certain things. But it's also important to have a team that looks diverse, because at the end of the day, that's real data. Real data is not segregated data. It's not, we can't develop an AI tool that's only for a Black person or for a white person or for an Asian or for an indigenous community. We have to develop tools that are perfectly integrated. Everyone is in that tool. Everyone is spoken for, because then that data can be used anywhere. You don't, if you want to leave and go to a different country, or leave and go to Quebec, or leave and go to a rural area, or an area where it's mostly Black and brown people there, you can still bring your tool with you. And so, like you said, this was a great step where when we reached out to you, we're like, yes, my mission and values align with you exactly. And you were very passionate about equity as well. And it's very important that we are bringing people like Dr. Crampton, who are not a part of our community racially, but we share that same passion of care, wanting to give standard patient care, high quality patient care. So I think this platform right here and Dr. Crampton agreeing to come on was so important and honestly admirable. And I do want to acknowledge that you took it up on yourself without, anything in return to come on this podcast and to educate us. And education is the first step and the most important step. And I think today we established that we're in that age where if you're not educated on something, you're going to get left behind. And of course, resources are not there for everyone. So what we're doing here is bringing the information to the people, empowering people. Yeah. So as we end on that point, I just wanted you to give your final thoughts, Dr. Crampton, on just how you want the viewers and audience to embrace AI in healthcare.
In the broader world, AI is advancing at incredible speeds, right? It's scary. Let's be honest. It's a bit scary how fast things are moving. I literally yesterday saw an AI code itself. Do you understand what that means?
No.
The AI was coding another AI.
It made itself.
It made itself. Okay, so this is what we're dealing with. Okay, and I don't want to sugarcoat it because it's so mind-boggling for us, what that means for what kind of projects get deployed, because that hits up against the real world. The healthcare system we just described is the real world, right? So, my final thoughts is, how do we come together as, I'm a proud Canadian. I'm really feeling my pride in Canada recently, for reasons we talked about recently. Because the cultures that we represent here is like a microcosm of the world, don't you think?
Yeah.
Yes,
so,
I agree.
So let's leverage that to our advantage to power the best AI, at a public-private interaction, and see how we can change the world. And the first step is keeping patients healthy. When you're healthy, you can do whatever you want. Go.
The society, there's a societal gain, right? I mean, the society, you have more people who are working, functioning, healthy, happy. I mean,
that's the base layer of
what else do you guys want?
Exactly. Yeah.
Right. So the product sells itself, right? Yeah. And I think Dr. Crampton coming on today, it's just one of those things where, wow, what an amazing moment, full circle moment. I mean, I haven't seen Dr. Crampton since probably 2000, I would say 16-ish. And I had no idea what he did. Him and we didn't talk much. I mean, we kept to ourselves. I was quiet in the clinic. He was quiet in the clinic. But if you were to get us, we talk about
not
everything
anymore.
But again, Noah, we're really thankful. It's a great conversation. I want to bring him back in 2026 and see where things are at.
Right, yeah.
I'm really looking forward to your projects. How can we find you on social media or on your website, or what do we look for?
Yeah, so, I'm typically represented by my company, Mutuo Health Solutions. So we're on Facebook, Instagram, and X, Twitter. And you can also email me. I'm happy to respond to emails, noah.crampton@mutuohealth.com. And if you're interested in AI Scribe or just learning about AI Scribes or learning about AI in general, this is what I do. I love to communicate about this stuff.
People are okay to email you?
Yeah.
Okay, and so is it Mutual Health is the company?
Mutuo.
Mutuo health.com.
Mutuo. Okay, so it's spelled,
it's the Italian
spelling. But a phenomenal company, look it up. save, check out their websites. There's new projects that you're going to be working on that we can't even talk about today, but I'm sure they're coming. And right now it's the Scribe, and that's the biggest tool. So thank you again, Noah. And looking forward to also talking to you more on a personal note about our collaborations. So it's exciting.
Thank you so much, guys. Really appreciate it.
Be sure to check out, if you're not using an AI scribe, be sure to check out Autoscribe. It is a subscription model, but it is certainly worth it. And if you don't like it, you can email Dr. Crampton.
Give him his feedback. And once more, we invite you to visit our website, bhpn.ca, and learn more about our upcoming gala with the theme Tech in Health this year in May. Thank you so much for tuning in, and we'll see you on the next one.
Thank you guys for tuning in to another episode of BHPN Presents.
Hey!
Hi, AI Unplugged.